I usually begin from the beginning, with all that is happening with healthcare, and you know very well what many crises, you will think, why are we doing this? So when the president came to power in 2009, if you remember, he had inherited two wars. There was the Iraq war, the Afghanistan war. There was a huge financial crisis. Our automobile system was in crisis also, but there was also a huge health crisis. We had, and I'm not going to read the slides, you can read them very well, we had millions of people in our nation who couldn't get insurance because they have a pre-existing condition. Here in New Jersey, we're what is called a guarantee issue state, so nobody can be denied coverage because of a pre-existing condition. But what would happen is if you have to buy it yourself, the cost will be so expensive that it will be equivalent to not being able to afford it. We have also over 50 million people uninsured in our nation when the president came to power. And the cost of health care was increasing every year. So you've heard of the gross national product, that's all the money that we spend that we have in the bank. Do you know what percentage we were spending on health care when in 2009? How many people think that is 1%? How many people think that is 10%? Oh, come on. I got up at 5:30 for you guys. Just raise your hands. How many people thought we're spending 10% of all our funding in health care? Only two people. How many people say 15%? So it was a little bit 16%. 60% we were spending of all our money on health care. And that's the top line. So without health care reform, that line was going to keep going up and up and up to it goes to 2082. I was not going to be alive then, but still we're going to be paying for that. So that's one of the reasons why healthcare reform was so necessary. Also, this is a number that people always get shocked when they hear it. Did you know that almost 1 million people in our nation were going bankrupt in our nation because of medical bills? And 1 million people. Do you know what percentage of them had insurance? How many people think it's 10%? How many people think that is, 25%? How many people think that maybe 75% had insurance? Well, let's see. Around 75% of those million people were paying for a card. And you think you're covered, but at the time that you needed the most, it didn't cover what you needed. Maybe you developed cancer and you go to the hospital. No, we don't cover chemotherapy. You're in an accident. You go to the emergency room. No, we don't cover emergency room. So you were paying for a card, but at the time that it needed the most, it didn't cover your expenses. And people end up putting them in credit cards, and then they will go bankrupt. So that's why in 2010, with the Congress, the Affordable Care Act was passed into law. So that is the law of the land, and it was ratified by the Supreme Court just last year. So what is the aim? What are we doing with this Affordable Care Act? So just to remind you a little, the full name of this baby is the Patient Protection and Affordable Care Act. And the patient protection part is very, very important, and we'll go over that in a minute. So we want to protect people from some of the worst abuses of the insurance companies. We want to make sure that healthcare is affordable for everyone. Healthcare is expensive. We want to strengthen Medicare. Why do you think that's so important, Medicare? It's been here for a long time. But do you know how many people become eligible for Medicare every day right now? How many people think it's 100 persons? How many people think it's 1,000 people? How many people think it's 5,000 people every day? How many people think it's 10,000 people every day? Around 10,000 people become eligible for Medicare every day. So that means 10,000 yesterday, 10,000 today, 10,000 tomorrow. So that's why this is so important. We want to make sure that Medicare is here for the people who have it, but also for the next generation, for some of us who are getting closer than others to get that triple color card. We want to improve access, and that's one of the important pieces of the health insurance marketplace that we're going to be talking about. And we want to improve quality of care. Just because you have an insurance card, you have a doctor, it doesn't mean you've been getting quality care. So that's important. So the first part, when I began this job 3 years ago, people said, this passed, the law passed, and I don't see any changes. Well, some things happened that began to affect you without you really knowing it. The patient protection part became effective immediately. So that means it is the law of the land that no child can be denied coverage because of a pre-existing condition. That will be true for everyone, including adults, beginning next year. It is the law of the land right now that no plan, no private plan, can put a limit on how much care is going to pay for the lifetime of the plan. I'm sure all of you are well read and you read the fine print of your plans, and maybe you're covered, I don't know, for $1 million, maybe $3 million. It sounds like a lot of money, but you know very well that if you have a chronic disease, if you have cancer, you can go through $500,000 in the hospital in a year. And what would happen is that after that, when you get to that limit, you are on your own. Very quietly, you're on your own. So now it is illegal for any plan to put a limit on how much care is going to pay for the lifetime of the plan. Also, it is illegal now, something that you think is common sense, that your plan is not going to drop you from your plan because of a mistake you may have made. But that was happening in our nation. Just to remind people, during the healthcare debate, and it was a big debate, there was a big case in California. This lady who owned a beauty parlor, she was buying her health insurance and she developed breast cancer. In the middle of the treatment, the insurance plan, they found out that she had forgotten to put down that she had suffered from migraines 10 years before. And in the middle of the treatment, they dropped her. Fortunately, she had ABC News and these all over the news, and of course, immediately she was reinstated in her plan. But not everybody had ABC News in front of them, and many people were dropped from their plans because of a mistake. Okay, I didn't mean to do that, but let's see. Okay, here we go. Also, you have the right to have an expedited appeal if your insurance companies deny something, and now it should be expedited very quickly, within 90 days. Also, you have the right to go to any emergency room, even if you belong to an HMO or a PPO, without being afraid that you're going to be charged more because you went outside your network. Women, you have the right to see an OBGYN without referral. Is that a big issue for women? It's also been a big issue, and now that is the law of the land. You have the right to see any primary care physician within your network. So these are some of the things that are already benefiting millions of people across the nation because of the Affordable Care Act that maybe you were not even aware. And this thing is very, very important. Now it is the law of the land that parents can keep their children until the age of 26 in their plan. This is optional. This is not mandatory. But because of that, we have the number is a little bit higher now, over 3 million young adults who are covered because they can remain on their parents' plan. And again, we're talking, healthcare is expensive, it's impersonal, but it's also very personal. After an event last week in Fanwood in New Jersey, this lady came to me afterwards. She works for Toyota. Her daughter has Crohn's disease. If you don't know what that is, it's a very painful inflammatory disease of the intestines. She's 19. She can keep her on her plan until the age of 26. She was afraid that after she went on her own, she wouldn't be able to get coverage. So again, this is what is happening. Parents can keep their children, young adults, until the age of 26. By the way, this young adult, they don't have to be in school. They can be working. They can be living at home or not at home. They can even be married. Basically, it's a decision of the parent to keep him or her in the plan. Now, it is the law of the land that every private plan has to spend 80 to 85 cents of your premium dollars on health care, on health-related care, not to pay the CEO, not to pay for marketing or outreach. It has to be on health care, and if not, you're going to get money back. Last year, over $2 billion were returned to many people across the nation, and a total savings of $3.4 billion. But here in the Garden State, over $10 million were returned to people and the employers. because those plans didn't keep to that 80-20 rule. That's real money that it was going to people here in New Jersey. Now, it is the law of the land that any plan that wants to raise your premium more than 10%, they have to post it and they have to justify it. The Affordable Care Act gave funding to every state to do what is called rate reviews, including here in the Garden State. So basically, your plan wants to raise it for more than 10%. The government here has the choice to do a review and maybe accept it or deny it. And because of that, over $1 billion was saved over the past 2 years. Now, it is the law of the land that private plans and Medicare have to offer approved preventive services without copayments and deductible. We all love prevention, we tout it, but prevention is not often cheap. If you have to decide paying, I don't know, $30, $40 for a copayment for a mammogram, you might delay it, wait a little bit longer. And meanwhile, if you're something that you're sick, it's a big hassle, a big mistake, and it could be very deadly, but also very expensive. So now, because of that, around 71 million people have at least access to one preventive services without copayment across the nation. And the number below is the people right here in the Garden State, over 2 million people. So Medicare, let's go back to that important piece. How many people have Medicare here? Important. This, again, this has been the lifeline for many, many people in our nation for years. We want to make sure that it's here for you and for the next generation. So this is Medicare to run it is expensive. These are the numbers for 2009. These are all the billions that are spent in Medicare. And for 2012, we don't have a number yet. In 2013, will be even more. By the way, do you know who is Medicare is run by one of our divisions, the Centers for Medicaid and Medicare, it's called CMS. Do you know which is the largest insurer in the whole world? It's CMS. We cover almost 100 million people when you combine Medicare, Medicaid, which is a combination of state and federal, and the CHIP, the Children's Health Insurance. So we are the largest insurance in the whole world. Almost 100 million people are covered by the government and with your funding. The cost of Medicare is expensive for many reasons. Usually when we get a little bit older, we are usually sicker. But I think this graph tells you a story. 20% of patients in our nation spend 80% of the healthcare expenditures. Not all of them are Medicare, but the majority of them are Medicare. So imagine that 20%, this small population, spend 80%. That's why part of the healthcare reform to improve the quality is important to make sure that those numbers are more aligned to what reality is across the nation. Donut hole. People, do you know what how many people know what the donut hole is? There we go. Medicare has 4 parts. Has A for the hospital, B for the providers to the outside visit, C is the Medicare Advantage, and D is the prescription drugs, which was passed in 2003. Very important. When you are a senior, and some of us even younger, sometimes you're taking 2, 3, 4 medications, and if you have to pay for it, it could be quite expensive. So that's why this Medicare Part D was so important. But unfortunately, it doesn't cover everything. When you reach a certain point, you have to pay it from your own pocket. That is the famous donut hole. The Affordable Care Act is going to close that donut hole. You wish it was in a year and 2 years. Unfortunately, it's going to take a few years, 2020. But right now, those seniors who get to the donut hole, right now they're getting a discount at the cashier, 52.5% right there when you buy your medication after you reach the donut hole. An important thing about it also is important because it's the quality. For us, before this job, I was working in a hospital for 25 years, but many people who are in healthcare will attest to this. Usually, after Labor Day weekend, you get to see an increase of seniors in the emergency room. One of the reasons is because that's the time where many seniors reach that infamous donut hole. And you know what happened? They start dividing the pills. They want to skip the pill. They might not get the medication because they don't have the money, and they end up in the emergency room. So that's why it's important to make sure that every senior is covered with the Part D completely. Another thing important for the cost of Medicare is, unfortunately, a lot because of the lack of coordination. Many seniors and disabled who are discharged from the hospital, they end up being in the hospital within 30 days. And that is bad medicine, but it's also quite costly, $26 billion. And we're going to talk about how we are trying to stop that right now. Fraud. This is one of the favorite subjects that I hear when I go to many senior centers. Seniors hate it when they are tricked, they are taken advantage, and everybody should be. But one of the things that the Affordable Care Act is doing and has done is to increase the teeth to fight fraud like never before, the technology. Right now, we're using the same technology that banks are using for the credit cards. So for example, if you're here in Pomona and suddenly you get a call from Citibank, by the way, somebody with your name is buying a ski something in Utah, you know that it's not you. So somebody stole your credit card. We're using the same technology to fight fraud before it gets paid, but also even now, even when it's paid, we have expedited prosecution. Because of that, last year we recovered over $42 billion that went back to the Medicare Trust Fund. And since the law was passed, it was $15 billion. That's a lot. That pays a lot of chunk of care for our seniors. Improving access. So again, that's one of the promises of the Affordable Care Act. We want to make sure that more people are covered. How many people here have insurance? How many people here know someone, and I won't even put you on the spot, know someone who is uninsured? That's right. And how many people here buy their own insurance? You have a small business, you know, you're unemployed. That's right. So, and we know how expensive that is. By the way, if you think that, you know, people are uninsured, it doesn't bother me. On average, this is I think it was a report from the Institute of Medicine. On average, we spend $1,000 of your premium dollars when you have a family plan, let's say $15,000. Around $1,000 of that premium goes to pay for uncompensated care. So if you think it doesn't affect you, it does. We are all subsidizing for people who are uninsured. And the people who are uninsured is not necessarily because they're lazy. They're working in a situation where insurance is not offered. So this is a map of the uninsured across the nation. As you can see, the darker the color, the redder, that's the larger the number of people, the uninsured. So Texas and the South. Luckily, on the East Coast, we're doing a little bit better. We're green. Hopefully it was white, but we're green, so we're doing better. But it's a big number of the uninsured. So one of the important pieces of healthcare reform that began immediately was to put money on the ground to make sure that we can see more people who are uninsured. And that's because the Affordable Care Act is investing $11 billion for the next 5 years to expand the community health centers. And we have one here, the Atlantic Care. These are what is called federally qualified health centers that receive extra funding, and they are approved by the federal government. They have provide quality care to anyone who entered through those doors. Quality care for everyone. And here in the Garden State, we have 20 centers, and they have 125 satellites. And again, they're all over our Garden State. So the health insurance marketplace. Have you been hearing about healthcare.gov? The website? Something is happening with the website. No, we know that. So the big promise of the Affordable Care Act is that every state will create what is called a marketplace. This place, this entity, where people who are uninsured, people who buy their own insurance, or small businesses will be able to buy affordable coverage in every state. The law was designed very state-friendly, and it gave the state the flexibility to create their own marketplace. New Jersey is one of the states who decided, no, we're not going to run it, and the federal government will run it. Meanwhile, our friend next door, New York, is one of the states who created their own marketplace. And by the way, they have already processed 220,000 applications in New York. So we are going to cover, we're hoping to cover over almost 41 million, but I think the goal right now, and I'll go why the number is a little bit different, around 32 million people by 2019. And that will include private insurance, Medicaid, and CHIP. The CHIP is a health insurance plan for children. So Open enrollment began October 1st, and it will end in March 31st of next year. And you have to enroll before December 15 for your coverage to become effective on January 1st. Nationally, that's everywhere. Please note that every member of Congress have to buy their insurance from now on through the health insurance marketplace, no matter who they are, from Texas, New York, New Jersey. If you want to be covered, you have to buy it through the health insurance marketplace. Okay. Yeah. No comment. So we're going to make it affordable. How do we make it affordable? We're going to offer different levels of care. You probably have heard about the different platinum level. So the difference between in the Bronx, the premiums are low because you're responsible for 40% of the cost sharing. 40% come from your pocket, and the premiums are lower. The platinum, you're only responsible for 10%, but the premiums are a little more expensive. So you have different choices. To have a comparison with Medicare, Medicare will be something like gold, because remember, if you have Medicare, you're responsible for 20%, okay? They also offer what is called catastrophic coverage. By the way, this is a terrible name. I didn't invent it, but this is what they're called. This will be for young people who are 30 or younger. So basically for the younger people who are healthy, there will be less benefit, the same protections, but it will be less expensive. Okay. These are the plans that are offered here in the Garden State: Horizon, AmeriHealth, and Health Republic. They offer 26 plans and 3 catastrophic plans. So there's a lot of choices for everyone. You have many, many choices at different prices. Important. This is so important for all of us who have been working for healthcare. This is a huge thing. Every plan offered through the marketplace and every private plan beginning next year have to offer those 10 essential health benefits. They can offer more things, but nothing less. Please note that for the first time, every plan will be required to offer mental health and substance abuse. Every plan. Here. Every plan has to offer rehab. Every plan has to offer prescription drugs. It sounds reasonable, no? But we don't want anybody to go bankrupt again because you bought something that really didn't cover enough. And every plan has to offer at least oral care for children and vision care. They can, in New York, by the way, New York, some of the plans are offering dental care for the adults. So basically, they're offering a little bit more to attract more people. But again, every plan across the nation, those are the 10 essential benefits for every plan and now on. This is so important, folks. If you can, if this part, I would say, is the heart of my presentation, and if you can let other people know, it will be crucial. Health insurance is expensive. I know that. We know that. But the Affordable Care Act is going to help you pay for your coverage. For example, if you are an individual making around $45,000, you may be eligible for a subsidy. If you're a family of 4 making around $94,000, you will be able to get a subsidy. That subsidy goes to the plan that you pick in the marketplace. And that subsidy is not for a year, for a month. It's for the lifetime of the plan while you keep it. Also for low, Medicaid, this is another important piece. The only thing that was different when the law was ratified by the Supreme Court was one thing. Now every state has the option of doing what is called a Medicaid expansion. It's an option now. Luckily, here in the Garden State, the governor said we're going to expand Medicaid, and that is a huge thing because that means that, like when he announced it, close to 300,000 people now will be eligible to be covered in the Garden State. Beginning next year, for any state that expand the Medicaid expansion, the only criteria will be your income. If you make $15,000 you can be a man, woman with children and without children, or a family of 4 making $30,000. In New Jersey right now, if you're a man, until December actually, and you need Medicaid, how much do you think is the maximum that you can make? You want to, he said $1,000? He said $10,000? He said $5,000? It is around $5,000. If you're in New York, New Jersey, and you're a man and you're looking for Medicaid, that will be the maximum that you can make. Now, because of the Affordable Care Act, the only criteria will be the funding. How much money do you make? Okay. For low-income families, we're going to help you pay for those co-payments and deductibles. Again, if you're an individual making $28,000, we're going to help you pay for that. A family of four making $58,000, we're going to help you pay for that. Again, that's for the lifetime of the plan, or if your income changes, of course. That will be based on your income and the family size. These are some of the states, these are the only states that are expanding Medicaid. Please note, we're very proud to say New Jersey is one of those states. In places like Texas, who has the largest number of the uninsured, they're not doing that. So millions of people will remain uninsured in Texas or Pennsylvania, for that matter, because the governor didn't do the Medicaid expansion. And meanwhile, they can do that anytime, but they haven't done it yet. Also, very important, no matter which plan you pick, we're going to protect you from catastrophic costs. The maximum out-of-pocket expenses for an individual will be $6,300, for a family of four, $12,000. So that's the maximum that can come out of your pocket. We don't want anyone to become bankrupt again. Let's talk about this that has been a little bit in the news. And Andrew, I think you're here, so this is your article, so you want to maybe expand on that. Andrew from Spotlight. You probably heard a lot of people getting these notices that your plan has been canceled, no? This is no surprise. This is part of the law, and now let me explain it a little bit. The law allows insurance companies to grandfather plans that they are not keeping to the minimal essential benefits, but they can become grandfather and remain until a couple of years, 3 years from now, 4 years, whatever. They can remain. Many plans, including many New Jersey insurers, decided not to take advantage of this. So they knew in advance that these plans do not meet the criteria, are going to be phased out. And that's why you hear those notices right now. So the plans decided not to grandfather those plans, those insurance, and now people are getting those notices, okay? This is some of the quotes from Horizon here. And again, these are the people who will be able to enroll in the health insurance marketplace and get quality coverage and probably subsidies. I'm going to mention about this one because it was all over the news. I think CBS, they interviewed a lady. She had this plan, the Go Blue plan in Florida. She was paying only $54. How can you say you don't want to keep that plan? But you know how much you pay for prescription medication? Only $15. These are the numbers, and it didn't cover the thing that she needed. So essentially, she was paying $650 a year to be uninsured. Okay, that's the reason why these plans are being phased out by the insurance companies. They don't cover everything that you need. And these are only what is called the individual market, not if you're a large employer. These are the people who buy their own insurance. So here we are in New Jersey, the Garden State. So we have the darker the color, the more the uninsured. Cumberland, you see, is one that has the highest percentage of the uninsured, but most of them are northeast part of New Jersey. These are the number of people who will benefit from the health insurance marketplace. The numbers, it's over 900,000. The numbers are a little bit different from what you see in the census because these numbers do not include the undocumented. The undocumented cannot access the health insurance marketplace and cannot get benefits. That is a battle that was fought. It was lost. It's not part of the law. So the number who are in New Jersey is that number. Please note that close to 800,000 of them will be able to get low coverage, including subsidies. The way to enroll, besides the website, which, by the way, is improving, and they have opened over 700,000 accounts in the healthcare.gov, but if not, you can do it on the phone, 318-2596. You can do it through the navigators who will be outside to the community health centers to paper applications. And if you want to find out who is there in your neighborhood who can help you fill out an application, you call the 800 number, or you go to the website, and there will be a section with local help, and you can put your zip code, and it will tell you who are the organizations right here in Atlantic County who can help you enroll. The application has to be different from any of the application in the past. It's called streamlined. It's very simple. It should be one application, and that application will determine if you are eligible for private insurance, for Medicaid, for CHIP, and also it will determine if you're eligible for the subsidies, all through the one application process. This is what the website looks like. Even if you cannot enroll, there's a lot of information. If you want to get information about healthcare reform in the marketplace, you can go to the healthcare.gov right now, and you can access it and get it. You can compare easily plans to plans, no fine print. You have to be next to each other, easy to understand, so you can make the right choice. And it can show on the bottom all the things that you need. If you want to find out what your network is, it will lead you to the page of the insurance plan that you're trying to buy, and it will let you know what are the networks, the physicians, the hospitals that they cover. So this was just November 7th. People are concerned about a rate shock and how expensive, but the truth is, when you add the subsidies, the majority of the people will get affordable coverage, sometimes zero premium, okay, with the subsidies. And about half of those, the plans will be zero premium for 39 years or less. Okay. There are already people on the ground, navigators, people who can help you train, enroll, or get information. There are navigators. There are 5 groups in the Garden State Certified Application Councils. They're outside enrollment assistance programs that will be running around the Garden State, the 21 counties, to enroll people. Agents and brokers, if you're already dealing with an agent and broker, he or she may be able to help you by enroll in the marketplace. Again, open enrollment began October 1st, ends on March 31st, and then next year, the open enrollment will coincide with the Medicare open enrollment. But if you're eligible for Medicaid or CHIP, you can enroll throughout the year. That's important, throughout the year. And can you enroll besides the open enrollment? Yes, these are some of the examples where you can enroll besides that open enrollment period. If you lost your job, you lost your insurance, you can enroll at that moment. What are the requirements? You have to live in New Jersey, you have to be a U.S. citizen or a lawful immigrant, you cannot be in prison. Good. What information do you need when you go to the office or you want to apply? So these are some of the information you will need to make sure that the application goes well, so you have to be prepared. We know this, if everybody's expected to have health insurance next year, if you can afford it. If not, there will be a penalty. This is what you hear about the penalty. If you don't enroll, you will get a $95 penalty or a 1% of your taxable income, and that will increase to $695 or 2.5% of your taxable income in 4 years. But next year will be just $95 or 1%. These are some of the exemptions that people who are not be expected or not required to enroll in the marketplace that can remain uninsured. Okay. Again, this is the call number, 1-800-318-2596. It's open 24 hours, 7 days a week. It's bilingual, but it has the capacity to translate 150 languages. Improving quality, and this is the last part of my presentation, and then we'll invite the panel. How am I doing with time? 10 minutes, okay. So I mentioned, this is one of the problems. We want to improve the quality of care. So these numbers are terrifying. 2,000 people. You know how many people, who knows someone who had himself, herself, or know someone who had a medical error in the hospital or in the office? I am sure that all of you know someone who got the wrong prescription, who was dropped off early. Everybody knows some. It's bad medicine, it's bad quality, it's very expensive. it leads to many, many deaths every year, okay? So part of the Affordable Care Act, and this is not in the news, but this is so important, the creation of what is called the Innovation Center, which is a huge center within CMS that is testing what are the best things that work in your neighborhood, in the state, that maybe we can replicate it everywhere else. What systems, what programs that provide better care at a lower cost, and where you are the center of care. So right now, this is the current system what we're aiming for. We are uncoordinated, unsupported, unsustainable, but we want something where coordination is at the center. And right now, you still go to an office and they're still going paper charts. That is so 20th century, no? But that electronic health piece is so important for your safety, but also to make sure that that information is out there by the people who need it at the time when you need it. So we want to make sure that care is patient-centered. You are at the center of healthcare and not other way around. How many people feel that you went to the doctor, they did a test, you went to another doctor, they repeat the same test? I mean, the same x-ray. This is this expensive. It doesn't make sense. I usually, today, this means a lot to me because today, my father died 3 years ago today. He had diabetes, he had bad kidney function, he had hypertension. He could have taken better care of himself, but you know what? The system also failed him. He had 5 specialists, 3 of them in the same building. Sometimes he will call me, he said, I get this prescription. He said, do not take that prescription. It's going to kill your kidneys. So the same doctor who was taking care of that couldn't communicate with the one above him. So luckily, I knew a little bit, but that is an example of how a person can really endure something because of lack of coordination in healthcare. It somehow had it vividly in my mind today. So this innovation center is $10 billion that already is proving fruitful in our nation. I'm not going to give you a quiz, but this is some of the examples of the many projects that we're testing across the nation. And I want to speak about a couple of them, the Partnership for Patients, but the accountable care organizations, because I know that Steve will speak about that. We have an ACO here in Atlantic County, and I know that he will be talking about that in a minute. But how many people have felt that? No one is responsible for coordinating my care. You go to the doctor, who's responsible here? No, it's not me, it's somebody else. This is one of the pieces of healthcare reform that has to change. We need to make sure that we coordinate care so we protect you and also save money. The accountable care organizations, you probably heard those names, ACOs. These are groups that are formed, that have been asking to become a reality. There are over 500 across the nation. There are several here in the Garden State. And the idea is they band together, groups banding together to provide better care, coordinated care, and to lower the cost. But make sure that you are at the center of the care. Medical errors, again, this is a big, big issue. This is a report from last year. Over 195,000 people died potentially due to medical errors. This is unconscionable. We need to do better. We have to do better. One of the pieces that we're working for that is the Partnership for Patients. The idea is to lower the amount of medical errors. And there are partnerships in every state, very much here in the Garden State with the New Jersey Hospital Association, who's doing tremendous work to reduce medical errors here in the Garden State. And our goal is to decrease medical errors by 40% in a few years from now, and to save over 60,000 lives and save money. But that's the main thing, saving lives. Lastly, people recognize the painting, the allegory, the Tower of Babel. This is in the Bible in Genesis where they're building this up, but the people are not communicating. So the tower looks very impressive, but the basis is not working so well. It's not sustainable. And this is a little bit of what is happening in our healthcare, where there's not enough coordination and communication. Lastly, I want to talk about electronic health records, because people sometimes get a little bit queasy when they hear about that. These are your medical records that now can be in a computer, and they can be accessed by a hospital, by a pharmacy, and it has to be private. Your privacy is paramount. But again, it can reduce unnecessary services that are duplicative, make sure you get quality care. And again, so if you hear about those things, do not be scared about what it means, because we're talking about that you are responsible. You can access them, by the way, but also other people can with the purpose of making sure that you are at the center of care. And when that happens, we have a different kind of pyramid where the patient get better outcomes because of the improvements that we're trying to make. The last slide. So people say, you know what? How is this? Is this saving money? But this is from October of this year. So the bending curve, the curve is bending in healthcare, and it has lower 3.9% in Medicare and Medicaid services. So the curve is coming down because of all the changes that are happening in our nation. We're going to take your questions, but anyhow, I just want to thank you for your time. Here, we're going to answer your questions or try to answer many of them, but if I cannot answer, this is my email. Do not call me. I'm in a car all day, but if I get an email, I promise that I can back to you. Thank you very much.